let's go ahead and just get started. So today's video is going to be about cellular damage 101. This is an introductory video to cellular damage. This is an extremely high yield video because, as we know, our body is made of trillions of different cells. So if there's cellular damage, it can be very detrimental to the body. More importantly, if we can understand what's causing the cellular damage, we can start to understand different disease processes that are happening within the body, but more importantly, why. So by the end of this video, you will have a firm understanding in basic principles of cellular injury, cellular adaptation versus cellular damage, high yield causes of cellular damage, pathological manifestations not only for future tests but also as a future physician, clinical relevance, and USMLE practice questions. These will help you not only test your knowledge but more importantly solidify your knowledge for the long term. Don't forget to visit at thehealingpowerofnature.com for the best study materials. Basic principles of cellular injury. Definition: cellular injury occurs when stress exceeds the cell's ability to adapt, leading to structural or functional damage. So think of a rubber band stretching too far. When you were in kindergarten, stretching rubber bands as far as they could go, there's a certain point of elasticity. Once you cross that threshold, the cell or the rubber band breaks, making it unusable and also unable for repair. So just like the rubber band, once cells reach a certain threshold, it is unusable and unable to repair. It's very crucial you understand that topic. Factors influencing injury. Ischemia, reduced blood flow. So without blood, there's no oxygen or nutrients. Think of it like a power outage in a hospital, okay? Essential systems shut down quickly. For example, an embolus or a blood clot cutting off blood supply to the brain can cause stroke. Acute stress causes more damage, like an embolus causing acute ischemia, or compared to chronic stress like atherosclerosis, which will cause atrophy. Inflammation, it's like the body's defense team getting too aggressive, all right? While inflammation is meant to protect, excessive inflammation, like in autoimmune diseases like lupus, can cause collateral damage to healthy tissues. Toxins, chemicals, drugs, or infections can poison cells. Think of alcohol damaging liver cells, for example, or bacteria toxins from Clostridium difficile destroying the gut lining. Trauma as well. Physical forces like cuts, bruises, or crushing injuries that destroy cells mechanically. These are very, very high yield, okay? Severity of stress, acute versus chronic stress. Not all stress is created equal, okay? So think of the rubber band. It depends on the degree and the duration of stress that significantly affects the outcome. Acute versus chronic stress. So acute stress, sudden, intense stress can cause immediate catastrophic damage. Picture an embolus causing acute ischemia in the heart. What's an embolus? It cuts off blood supply suddenly. It's like slamming the brakes on blood flow. The result, myocardial infarction or a heart attack. Now, chronic stress, prolonged lower intensity stress gives cells more time to adapt, but it can still lead to damage over time. Think of atherosclerosis slowly narrowing the arteries over decades, causing atrophy in tissues that receive less blood. An analogy I like to think about comparing the two is acute stress is like throwing a giant ice cube into a small pot. The system can't handle the shock and chaos ensues. Basically, it's going to become cold very fast. Chronic stress is like simmering the water slowly. Slow changes build up until the pot overflows and is boiling. Must know causes of cellular injury, okay? All of these are going to be very high yield, and we're going to go ahead and start planting seeds on different disease processes. We'll have videos talking about each of these. Hypoxia means low oxygen deprivation. So think of a car running out of gas. Without oxygen, cells can't fuel their engines or the mitochondria for energy production. Hypoxia decreases ATP production, leading to cell dysfunction. Causes can include ischemia, blood flow is blocked or cutting off oxygen. Anemia, oxygen delivery is insufficient due to low hemoglobin. Carbon monoxide poisoning, carbon monoxide outcompetes oxygen 200 times for hemoglobin, meaning that oxygen can't bind. Or even high altitude sickness, so low oxygen levels in the air reduce oxygen availability. So memory tip, NO2, no ATP. ATP pump failure, swelling happens, acidosis, because lactic acid will build up in the cells. We're going to go ahead and talk about all of these, but we're just starting to plant seeds in your brain. Ischemia. What is ischemia? Ischemia is loss of blood flow. Okay? Ischemia is like a traffic jam. Nutrients and oxygen can't reach their destination. Ischemia is a severe form of hypoxia that causes both oxygen and nutrient depletion, which leads to rapid and irreversible injury. Inflammation or immune-mediated injury. Inflammation is like fire. Controlled burns are protective, but out of control flames can destroy tissues. While inflammation is critical for defending against infection or injury, excessive or chronic inflammation leads to tissue damage. So acute inflammation would be short-term, often beneficial, because neutrophils, cells in your body, are responding to infection. Chronic inflammation, however, is long-term, often harmful, like autoimmune diseases, such as rheumatoid arthritis. High-yield examples will probably come up for you over and over again in clinic and outside of clinic: tuberculosis, chronic granulomatous inflammation, hepatitis B or C, which means chronic liver inflammation, which leads to fibrosis. Key insights: remember, persistent inflammation often causes fibrosis or organ dysfunction. Chemical injuries: spilling acid on your clothes, for example. It disrupts and destroys normal structures. Explanations for this could be direct toxicity: cyanide inhibits cytochrome oxidase, blocking ATP production. Or indirect toxicity could be acetaminophen overdose, toxic NAPQI buildup, which leads to hepatocyte death. Acetaminophen toxicity is favorite for USMLE, so continue to plant these seeds. Infectious agents, what could that be? Pathogens are like thieves. They invade and steal cellular resources, leaving destruction behind. For example, viruses hijack the cellular machinery for replication, leading to apoptosis or necrosis. Bacteria, they release toxins, like, for example, exotoxins like diphtheria toxin. Mnemonic, you can remember: infectious agents insult. What does that mean? Inflammation, necrosis, suppuration, ulceration, lysis, and toxicity. Physical agents. Think of physical forces as natural disasters, earthquakes, heat waves. They cause direct destruction. So some examples: mechanical trauma, crush injuries, or fracture cause structural damage. Temperature extremes. Radiation, UV or ionizing radiation, causes DNA damage. UV radiation does what? Pyrimidine dimers or kinks in your DNA, which leads to cancer. Nutritional imbalances. A malnourished cell is like a starving person or an overfed person, lacking or overload with essential nutrients. So there's deficiency and excess. A deficiency that's very common is with vitamin C. What does vitamin C lead to? Scurvy, impaired collagen synthesis. Excess, hypercholesterolemia. What does that mean? Lipid accumulation or atherosclerosis. So too little or too much and cells can't function. Genetic abnormalities. Think of a blueprint with errors. Genetic mutations create faulty proteins, disrupting cellular functions. Mutation causes systemic effects, such as with sickle cell anemia, abnormal hemoglobin, RBC deformation, ischemia, cystic fibrosis, CFTR mutation, defective chloride transport, mucus buildup. Single gene disorders are USMLE favorites, okay? Free radical injury, for example. Free radicals are like sparks in a firework factory. One spark can cause widespread damage. So reactive oxygen species, or ROS, damage DNA, proteins, and lipids. For example, hemochromatosis, iron overload, generates reactive oxygen species. Don't forget, antioxidants save the day. Glutathione neutralizes ROS, for example. Apoptosis versus necrosis. Apoptosis is like planned demolition, controlled and cleaned. Necrosis is like a nuke. It's like Hiroshima, messy, chaotic destruction, widespread. Apoptosis is programmed cell death. Necrosis is uncontrolled death. So apoptosis, no inflammation; necrosis, inflammation. I like to think of hip ginger facts. I think of a ginger who's just raging. This is a mnemonic you can use to remember cellular injury. H for hypoxia, I for infection, P for physical agents, gene for genetic abnormalities, I for immune reactions or inflammation, N for nutritional imbalances, F for free radicals, A for aging, C for chemical agents, T for trauma, and S for shock or ischemia. Additionally, the cell type matters. Different cells have different sensitivity. So the highly sensitive cells, these cells are most vulnerable to injury, particularly Hypoxia and ischemia, no oxygen. Due to their high metabolic demand and reliance on continuous oxygen and ATP, think of a hummingbird who's very small, very fragile, and constantly needs energy or nectar that they collect. So highly sensitive cells are like hummingbirds. For example, neurons, highly reliant on aerobic metabolism for ATP production. Ischemia leads to failure of the sodium-potassium ATPase pump, causing membrane depolarization. What does this do? Influx of calcium, excitotoxicity, and irreversible damage within 3 to 5 minutes. Cardiomyocytes require continuous ATP from oxidative phosphorylation to maintain contraction. So ischemic injury can happen below 20 minutes. If it's within a 20 to 30 minute range, it's irreversible with membrane rupture. Below 20 minutes, you have more of a possibility for reversibility, but cardiomyocytes are still very sensitive. Not as sensitive as neurons, but still very sensitive. Renal tubular epithelial cells, particularly in the proximal tubule and thick ascending loop of Henle, due to their high oxygen demand for active ion transport. Zone 3 hepatocytes, or liver cells, located near the central vein, they receive the least oxygen, so resilient cells. I like to think of a camel analogy. Just like camels are uniquely designed to endure harsh desert conditions, such as extreme heat, water scarcity, and limited resources, cells also have mechanisms to survive and adapt in challenging environments, depending on the cells. Some of these highly resistant cells would include skeletal muscle. Why? Because they have anaerobic metabolism. So during hypoxia, skeletal muscle can switch to glycolysis, or anaerobic metabolism, producing ATP and lactic acid as a byproduct. The key enzymes are lactate dehydrogenase, LDH, which converts pyruvate to lactate. They also have slow twitch fibers, type 1, rely more on oxidative phosphorylation, so they are less resilient to prolonged hypoxia, but they also have fast twitch fibers, more glycotic and tolerated to hypoxia. Smooth muscle cells. These cells are slow contracting and can sustain activity during hypoxia. For example, the blood vessel walls and organs like the GI tract. Fibroblasts, critical for wound healing. They survive hypoxia due to low metabolic activity and can proliferate even in ischemic tissues. They produce collagen, aiding tissue repair after damage. Epidermal cells, or your keratinocytes, skin cells, are exposed to varying conditions and adapt well to ischemia. They rely on anaerobic glycolysis in the absence of oxygen. Bone cells, or osteocytes, low oxygen requirement due to their low metabolic rate. Bone healing can proceed in hypoxic environments, such as during a fracture. Adipocytes, minimal oxygen demand. Fat cells, they survive as energy storage, releasing free fatty acids, or FFAs, during stress. So, mnemonic, to make this even easier, no oxygen harms tired zones. For neurons, oxygen deprivation, heart, T for tubular cells, and Z for zone 3 hepatocytes. Mnemonic for resilient cells, sturdy cells, fight. Skeletal muscles, collagen producing fibroblasts, and flexible smooth muscles. These are just general, but it allows you to get a firm understanding. So, clinical application, integrated pathology. These are high yield. Understanding how different cell types respond to injury is essential for pathology and clinical correlation. Here's a concise breakdown. Hypoxia-driven conditions like stroke, neurons, which are highly sensitive, undergo ischemic necrosis within 3 to 5 minutes. Cardiomyocytes, hypoxia leads to coagulative necrosis within 20 to 30 minutes. Acute tubular necrosis, or ATN, proximal tubular cells are highly susceptible, causing muddy, brown cast in urine. Inflammation-driven conditions. So for chronic inflammation, fibroblasts promote fibrosis, leading to organ damage. Autoimmune diseases. Immune attacks target sensitive cells like synovial cells in rheumatoid arthrosis. Nutritional imbalances. So high-yield examples would be vitamin B12 deficiency. It damages myelinated neurons, causing subacute combined degeneration of the spinal cord. Also, iron overload. Zone 3 hepatocytes are affected in hemochromatosis due to oxidative stress. Trauma-driven pathology. So, rhabdomyolysis. Skeletal muscles break down, release myoglobin, causing renal. So that breaks down our video for today. I know it was a lot. Let's go ahead and jump into some USMLE practice questions. So, number one, like I will always tell you, start with the end of the question, then read your responses, Then read the entire situation. If these questions don't make sense, it's completely normal, but these are very high yield examples. I guarantee these will show up at some point in time, whether in clinic or outside of clinic. So planting the seeds now is imperative. We'll continue to dive into each of these different disease mechanisms so you'll have an even greater understanding. B was correct. Why not A? P small a O2 remains normal because oxygen diffusion into the blood is unaffected. Saying P small a O2 is not decreased in CO poisoning. Why not D? S small a O2 is decreased due to CO binding hemoglobin. Question number 2. Good job. C. Methemoglobinemia. So why not A? Anemia does not cause chocolate-colored blood in cyanosis. This is a key finding. Why not B? CO poisoning presents with cherry red skin, not chocolate-colored skin. Why not D? Right to left shunts cause cyanosis but not chocolate-colored blood. Let's go ahead and go into our last question. Good job. It was A. So why not B? So VQ mismatch occurs in conditions like pulmonary embolism. Why not C? High altitude is unrelated to this case. Why not D? Hemoglobin levels are typically unaffected in interstitial lung disease. That concludes our video for today. I know it was a lot. I recommend watching this video over and over again until you understand it completely. Use the mnemonics, and don't forget to check out thehealingpowerofnature.com for the best resources available on the market. Thank you very much.